5F9 is a IgG4 monoclonal antibody that selectively targets CD47, basically interferes with the interaction of SIRP-alpha on macrophages with CD47 on cancer cells, and this ultimately leads to induction of phagocytosis. As far as preclinical rationale, we know that azacitidine can upregulate these pro-eat-me signals. And in an aggressive AML xenograft model, the combination of 5F9 with azacitidine significantly improved overall survival in these models versus either 5F9 or azacitidine alone. And so from a previous phase 1 experience that had shown the agent to be safe, we conducted this current phase 1 trial of combination of 5F9 and azacitidine in AML patients that are unfit for intensive chemotherapy, as well as high-risk MDS patients that are intermediate or higher as defined by the IPSSR. This is a multi-center trial. As far as data that will be presented, there are 25 patients that are response evaluable. This is approximately 14 patients that had AML and 11 patients that had MDS. The median age in all patients treated to date was over 70 years of age. There was also a 10-patient cohort of patients who had failed prior treatment that got 5F9 alone, and again, relatively a similar patient characteristic. Additionally, if we look at the AML patients, over half of them had AML with myelodysplastic related changes. So again, really our treatment cohort consisted largely of elderly patients with an undertone of myelodysplasia. Both 5F9 alone or in combination with azacitidine was overall well tolerated with no maximum tolerated dose. Side effects that we expect with 5F9, so again, since old red blood cells can express these eat-me signals, predominantly in the first cycle, we can see a significant anemia, an average hemoglobin drop of 0.5 grams per deciliter. Importantly, patients typically got back to their baseline hemoglobin at the end of the first cycle, and along with achievement of response, hemoglobin significantly improved over time. We did have mild gastrointestinal side effects, and importantly, in combination with azacitidine, really saw no exacerbation of the monotherapy side effect profile of azacitidine. Importantly, no severe infectious complications, no significant worsening of cytopenias, and no immune-specific adverse events. Actually, if we look at all patients treated to date, only one patient was discontinued for an adverse event. This is a patient that had a severe infusion reaction with first infusion, and although all symptoms did resolve within 24 hours, that patient was removed from study. So I think excited about the safety profile, and there were no early deaths, at least within 60 days of start of treatment. As far as the activity, if we look in the AML patient population, we had an overall response rate of 64% with a composite complete remission rate of actually over 50%. And in the MDS group, all patients responded with a complete remission rate over 50% as well. I think importantly, if we look at their CBC parameters, all but 2 patients who had MDS did have hematologic improvement as defined by IWG, and in the AML cohort, 64% of patients achieved transfusion independence. I think what's important is many of these patients, even patients who have not objectively obtained a response, remain on treatment. The follow-up is relatively short, so we're actually hopeful that the percentages may further increase over time as patients remain on study.